And so, hey,
Hi.
hi, Dr. Ashaye. So good to have you. I was just, giving our listeners a little bit of a sneak peek of what we're going to be talking about. And I'm just really excited to have you here.
Yes, I'm excited to be here. Thank you for having.
Wonderful. Oh, you're so welcome. Let me see. Is this thing loud enough? Anyway, I think it'll work. So I think we'll just get started. Hi, everyone. I was so excited. I think I just jumped right in. I didn't even introduce myself. So for those of you who don't know me, welcome to the Restful Sleep MD Candid Conversations. And this is a platform I use to just have specialists, experts, friends, maybe a couple of enemies. Just talk about things that we end up connecting to sleep in one way or the other, or things that can help us as busy moms, as professional women, because we're on this journey together. And so I have a special treat today, Dr. Lola Ashaye. I know I will not do it justice. I'd thrown around words like primary care physician, and lifestyle medicine, and double board certified, and DPC, and expert extraordinaire. But I would love it if you introduce yourself to our friends, and then we'll get started.
Yeah, absolutely. So as you mentioned, I'm Lola Ashaye. I'm a family medicine doctor and lifestyle medicine doctor, and I am based in Sugar Land, Texas. I own a clinic, InTouch Primary Care. It's a concierge-like practice in Sugar Land, and the idea there is to be able to allow patients to directly associate with their doctors, and so that they can live fully and enjoy doing what they love. I'm very passionate about wellness and preventative health, weight loss management, and all the things that go into living and maintaining a healthy lifestyle.
I love it. So can you just shed some light? Because some of these terms are new to a lot of people. Concierge style medicine, direct primary care. Like, what is that and how is that a little bit different? And I just wanted us to just clarify that right off the start so that, people, we're all on the same page, especially around the services you provide, which is very unique.
Yeah, absolutely. So, today it's really a lot of people complain when they go to their doctor that everything is so rushed, right? They don't have a chance to ask questions that they need to ask. And so what we do in direct primary care is the model is membership based so that people have access to their doctor whenever they need it. So that takes away that rushed feeling that a lot of people have when they have to see their doctor. So that's the first thing. And then concierge-like means that they can actually reach you when they need you. So, when they call or text or email, they reach their doctor directly, which really helps put people at ease and helps them get questions answered faster and also gets them better faster. And then with lifestyle medicine. Lifestyle medicine is where we much more focus on lifestyle behaviors as a way of preventing and treating health conditions. And that way we can reduce dependence on medication. So that's really, a huge advantage for a lot of patients when their doctor is trained in lifestyle medicine, because it does help them, which a lot of patients desire, to reduce their dependence on medication. So it ties really well with the direct care model because we have time to go over those foundational lifestyle behaviors, and also ties really well with just medicine in general because people are really seeking more natural ways of taking care of their health.
Yeah, and I think I love this combination, right? You have, and we're going to be talking about hypertension and how to, just really have a conversation around hypertension, especially with women who are essentially constantly under stress, right? And the role it plays. But I love the fact, like, for me personally, I'm not a big fan of medication, like taking medications. I prescribe, but I know what the struggle is. And so when you're talking about a condition that is maybe potentially lifelong, how can we use, behavior modifications, lifestyle techniques to decrease maybe our dependency or the dose or stuff like that? Like, I think that is just so powerful. And I love the fact that with the model you have, where all of a sudden your doctor is actually accessible. It's a thing. there's a world where you can actually reach your doctor. Like your doctor is not just some phantom that we hear about but we never see. And that's the model you provide, and that's how you care for your patients. And I'm just so incredibly thankful for the work you do. And we'll talk also about those that in the area that would love to work with you at the end of this. And so I think this is a great segue to hypertension and women and stress. But I want to share a story, my own personal story. So, my blood pressure tends to run on the, I guess, good side, and you'll tell me if I'm wrong. It's usually around like low hundreds, like 110 over like, 60, thereabout. And then there are two times when my blood pressure goes up. It's when I'm going to see my gynecologist. And then when I'm also going to see my dentist, so you can tell who my favorite doctors are anyway, but we're not talking about that type of hypertension today. That's what we call white coat hypertension. But maybe you could just shed some light of what is that? What is hypertension? What are the definitions? And then we could start to talk about why women who are busy and caring for everybody else really should be paying attention, because they may potentially be putting themselves at risk if they're constantly under stress.
Yeah. And so high blood pressure is simply when the pressure in the vessels are too high. And so it increases the risk of heart disease, because now the heart is pumping against a high pressure system, which makes the heart work harder than it should. And also, if the blood vessels are smaller than they should be because of the fact that they're constricted, that also increases the risk of stroke, because blood doesn't get to where it needs to go to, or heart attack, and things like that, and kidney disease. Basically, anytime blood cannot flow to where it needs to go to, that's a problem, right? So the thing about high blood pressure that makes it a very dangerous condition is you can feel perfectly fine and have high blood pressure. And that's the scary part, because a lot of people say, oh, I only see my doctor once a year, I'm fine, or they don't even go to see their doctor at all because they feel fine. And the high blood pressure or heart disease is actually the number one killer in worldwide. So people a lot of times take it for granted that they're fine because they don't have any symptoms. So that when you walk into any doctor's office, they check your blood pressure, just because we know that many people feel fine but can have high blood pressure. So it's really, the first step is check. Make sure the blood pressure is normal. Yeah.
And thanks for shedding light on that. I really want to draw attention to what you said. It doesn't necessarily show any signs. And by the time you start to see signs, it's either been long-standing or pretty severe, right? And it's just so subtle, like a silent killer. And I think that's why we need to shed light on it. So maybe this would be a good time to really ask, like, why do you feel, because I think so, but you're the expert here, that women who are constantly under high stress, right? With our modern lifestyle, we are going, we have all these goals, these dreams for us, for our kids. We're comparing ourselves, we're pursuing this, like, sometimes unrealistic expectations. And we have this as a lifestyle now. How do you feel that could potentially contribute to developing high blood pressure?
Yeah. So I think definitely just modern age increases the risk of high blood pressure. A big part of it is our diet, right? And food is meant, and that's a big part. The fact that as women, we're busy, so what we're reaching, a lot of times the women feed their families, and we're reaching for the easiest, fastest, quickest thing. Unfortunately, that ends up being processed foods a lot of times. And so the fact that we exposing our bodies to processed foods increases our risk for inflammation in the body. And a lot of processed foods also have high contents of saturated fat, which also increases inflammation in our body. High contents of sodium. So those two things together increase the risk of high blood pressure. So I think definitely our diet makes a huge difference. The fact that we're highly processed diet. So that's the first thing. The other thing is, on top of that, we're not as physically active as we should be. A lot of us are sitting down to work most of the day. We're not up and about as we should, and so that again increases our risk for heart disease. Like sitting, even if you're physically active, say let's say you work out 30 minutes 5 times a week, and you sit for work most of the time, that's still an independent risk factor for heart disease. So outside of physical activity. So the fact that we're doing a lot more sitting now, people are working from home, they're not even walking to their car anymore. So
Wow.
they're sitting in bed from morning till night. That completely, increases their risk more. So that is another big factor. And then the big one is sleep, which I know this is your area of expertise, but that is huge. I think we underestimate the power of sleep. And I know you've talked about this a lot, but when we sleep, our blood pressure lowers. When we sleep, our sympathetic tone lowers as well, which allows our vessels to relax. And when we sleep, our baroreceptor sensitivity also increases, and that makes us quickly and appropriately respond to changes in our blood pressure that typically will happen. Like if somebody slams the door, quickly, your blood pressure should go up because it's a good response to tell you give you the energy to do the next thing. But when we sleep, when we don't sleep, all these things don't work the way they should, and that also increases our blood pressure. So our busy lifestyles basically have made with that, going for processed foods, decreased activity, not getting enough sleep, all that combined together, plus of course some people have genetic factors too that increase for high blood pressure.
Thank you so much for shedding light and also for highlighting sleep. I would be a bit biased to say that's a big one. And and here are just some of the things you've said so far. So diet is a big one. So think about you as that, and I'm speaking to folks on right now, or those that are going to watch this replay. You have this extremely stressful lifestyle. You have this demanding job. You have kids that you're taking care of, and all the other demands that are placed on you, and sometimes that we place on ourselves. And so you feel that stress, right? And you're not necessarily making those rational decisions to cook this whole plant-based meal at that moment in time. You just want to get through the day, and so you're either grabbing the leftovers from the kids, or that bag of chips because it's whatever it is, you're popping in the microwave real quick. And this is not in any way judging. This is just really shedding light to some of the things that are sort of our defense mechanism, but then maybe harming us rather than doing us good. So with that diet and also that stress level, living in that such a stressful condition, comes higher inflammation, high cortisol. Your stress hormones are elevated, right? And then you combine that with insufficient sleep, which also then raises your stress level. So it's a vicious cycle. When you're stressed, you may not be sleeping well. When you're not sleeping well, then your stress level goes up, and blood pressure is also affected. And then you also talked about physical activity. And I think that's one that is really something that we have to draw attention to. I love the fact that I get to work from home on some days. It's a beautiful thing. It's a blessing. It affords flexibility, but it could be a curse sometimes, because especially when you're so consumed with the work you're doing, you don't realize that you've been sitting for hours. And so that, independent of being physically active. So I'm someone who in the morning I have this my routine of exercise, but then what you're saying is, even after doing all that, it's almost like I'm negating all that good work that I put ahead by just sitting with good intention. And so I hope you guys can see how this then ends up leading to putting us at risk for hypertension or high blood pressure. And so thank you so much for shedding light. We always will end on a positive note, and that is, what can we do? But even before then, I love, and this is why, y'all, I decided Dr. Ashaye was perfect for this conversation because of our experience with her practice being a lifestyle medicine certified physician. Like, how do you then use this tool, lifestyle medicine, to help, your patients, to help potential clients that will be joining you through this live, improve their blood pressure without medicine, even if we need to do medicine down the line? But what are some things, and how are you the authority to be able to speak on this? Tell us a little bit about that.
Yeah, so I talked about the model a little bit
Yeah.
earlier and the fact that time to kind of go over it. But I think the difference I've noticed from just, when I was just family medicine versus this additional training in lifestyle medicine is because I have the information that motivates them to understand how things work. So for example, I can say things like, if you lose a couple of pounds, I expect your blood pressure to drop by 1 point. Or if you lose 10 pounds, probably going to drop by 5 points. And if you compare that to taking your amlodipine 10 milligrams, that's about, your blood pressure drops about 5 to 10 points with that. So you can literally half your dose or maybe even reduce your dose by, so by giving them that additional information that research has shown that if you do this, or if, for example, if you are physically active for 90 minutes a week, that would drop your blood pressure by approximately 4 or 5 points, which is similar to your hydrochlorothiazide that you're taking, so when they see comparison and they're like, oh, wait, I actually can do this, and we can talk detail about what their barriers are, why they're not able to do the 90 minutes, and not just, oh, you just need to exercise. Like, everybody knows that's not the problem. The problem is, okay, how for me, what does that look like for me? And so what we can help with, like saying, okay, for you, maybe walking is not the greatest idea because you're scared of dogs in your neighborhood. We have that conversation, right? Maybe talk about, do you have a treadmill? Do you have stairs in your house? Can you take breaks in between when you're microwaving your food and do stretches? Do you have light weights you can use while you while you are just waiting for your coffee to brew or something like that? So instead of just talking about things you potentially can do, we make it personalized to the person based on their conditions, and that really we've seen great results by doing that.
What you're just saying makes so much sense, and it really resonates. And I think the same applies to sleep, right? Especially if you're in a busy practice. I would tell you, eat healthy, sleep well, be physically active, lose weight, see you in 3 months. Here's your prescription. And you're like, duh, I could have looked on Google to do that, right? And I think that's just so helpful, because just like even for me, when I'm counseling my clients, it's beyond, okay, get 7 to 9 hours. How? I'm a busy mom of 4, or, I run a company. How am I supposed to fit 7 or 9 hours into my day of sleep, right? So I love the fact that what you're doing is then meeting us where we are. Like, what do you have? Like, you may not have a gym membership that you can go to consistently, but do you have stairs? How about we use that? You may not have 1 hour to, run, 3 miles or whatever, but do you have a treadmill at home, right? So I just love that. I love the fact that what you then do is provide practical strategies that people can then apply, which is what I think we should then jump into right now. Because there are a few things that I'm just like, oh, there's so many ways we could take this. But I think what we could do is maybe just the diet, because I think that's one of the ones that, sleep. Yes, you should prioritize your sleep and follow this content. You get so we don't need to beat that. We'll talk about that. We always talk about that. So I think what we should maybe talk about is diet. So I have this client who has a super hectic lifestyle, looking to make better choices. She's extremely stressed out. She's overworked. She's overwhelmed. She's just over everything, and her blood pressure is creeping up, and she's eating food that's causing a lot of high inflammation. So how can we use how do we practically implement this and say, okay, maybe I'm going to start with one, because yes, I need to exercise, I need to lose weight, I need to, do all these things, but maybe I'll pick one. And so let's pick diet. Like, what do you think? What would be easy, practical, and applicable, even starting today, for that woman?
Yeah, so I think first of all, having things that you can quickly access available. So when we
Mm,
think about, a lot of times we go for the processed stuff, but instead of going for the processed stuff, going for the raw stuff, like fruits and vegetables, especially fruits, are very, very easy to just grab an apple, grab some carrots, grab some, orange real quick. And if you have that on a schedule, so that's what I do. Basically, every week I kind of know, my cart is already, I can pre-fill my cart, I pick it up, or I can get it delivered. But I know, like, I'm going to have fruits and vegetables in my cart, and it's going to get delivered. So it's not too complicated, right? So that if I'm hungry, you know, if there are no processed foods, you can't eat it. You're not going to necessarily go out of your way to go and get it, except you did sleep well, and that's a different story.
yes.
But but if most of the time it's whatever is there that you're going to grab,
Mm.
right? So if you have things you can quickly grab and eat, apples, oranges, carrots, cucumbers, things that you can just get, take and quickly eat, that's one good one. The other thing is, try to plan ahead. Having a food schedule is so, so crucial, especially if you're busy, because the truth of the matter is we don't have all the time in the world. And when we don't have time to think ahead of time, it makes it really difficult to make good choices. So just and we actually save a lot of time by just sitting there once and just saying, look, what do I want to feed my family? What do I want to eat? And then writing it down, putting it on a schedule, and just know that that's what you're going to base your grocery shopping on. So that's the other thing I do. It's a one-time thing where I'm thinking about and you have yourself, plan A, plan B. So if this is not available, I'll eat this instead. But it really limits the amount of time it takes to think about what to make, which is usually when we reach for the processed things, the things that the noodles, it's really easy to cook. But if you had already planned ahead and you knew that, you were going to eat, for example, whole grain brown rice, something like that, that's already planned for. It's in your cart already, it's delivered. You've put it I usually make dinner and in the morning. So you put it in the Instant Pot, it's done. By the time you walk in the door, you're not now thinking about what you're going to eat. So I think by just being prepared, having it already written down, outlined for you, it makes it a lot easier so that you're not constantly thinking about it. And then freezing things. Freezer is your friend. Get an extra one, need one, and label things. So that's another trick that has worked really well for me. If I try to cook in bulk or order in bulk from somewhere, and I put it in Tupperware and label it so that I don't have to spend too much time. So even the kids can help because they know, hey, go get the spaghetti sauce out of the freezer. It's not complicated. They can take that out really quickly and easily, right? So
Mm.
doing things like that to simplify your life can really make a big difference for people. So taking advantage of planning ahead. And if you really truly are too busy to do it yourself, there are healthy food subscriptions that are out there that, people can take advantage of as well. Just get in and one of those subscriptions, even if it's not every day, but 3 times a week, finding a chef can be good. And it doesn't have to be expensive. People assume that when you say chef, it has to be, it really doesn't. If you do it one or 2 times a week and you specify exactly what you want and make sure that they're adhering to your healthy standards, and make a difference for you so that you can really feed yourself and your family healthier, because food is medicine.
Yeah, food is medicine, and you've shared so many gems here. So, a couple of things. I think the broad theme of this is busy women busy minds, busy schedule. When everything gets overwhelming, we don't make the best decisions. And then layer that on top of poor sleep, right? It doesn't go well. So don't complicate it. Don't make it seem like this really big thing. Sleep well. I think that's critical so that then to plan ahead, because when you don't plan ahead, then you're scrambling in the evening when everybody else, everybody's home and they're looking at you like, what are we supposed to eat? Then you're grabbing stuff that's maybe not what you would have loved to have cooked initially if you were not just so overwhelmed. So ditch the overwhelm by planning ahead, and it doesn't sound like it needs to take too much of your time, and may or will absolutely save many, many, many hours down the line. And then making it accessible, because if you don't buy the unhealthy stuff, then it's not going to be there for you to grab. And so really that planning ahead, making it making it accessible. I love that idea. And also I love the idea of, in terms of that accessibility, delivery options. So because the thought of going to a grocery store sometimes is just like, no, 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 I do not have the bandwidth. Let's order some Chinese, please, right? So if you have if you have it delivered, or you could even go pick it up, but you have, you use like one of these services, this subscription services, that I use Instacart, and it's just been a blessing, because then you could you populate your cart with the things that you want, right? So you're making sure that the fruits are there, you're making sure that the vegetables are there, you're planning ahead, you know exactly what you're going to have for the week. And then also freezing stuff, right? Like if it's in the freezer, then that way you could reheat, and you could meal prep, maybe choose a day on the weekend if it's possible, or just have a delivery service or a chef or someone do it. So it sounds like keep it simple, make it accessible, and plan ahead. And so if you can work with those, even just saying that in my mind already is reducing that stress level. And for many of you, it's also reducing your blood pressure. So this has been just so, so valuable, because when we then continue to make these right choices, and then, then we can start to see that change that we want in our lives. And so I really, really want to say thank you for sharing this with us. And then do you have any final words, as well as how people can work with you?
Yeah, absolutely. So what I wanted to just mention, sometimes when people have high blood pressure or just trying to lower their blood pressure, they get so concerned about what they can eat because there's so many, they feel restricted. What I tell people is don't worry too much about what you cannot eat. Focus on what you can eat. Focus on crowding out the bad stuff with increasing the good stuff. So if you just increase and focus on increasing your vegetable intake as much as you can, adding more fruits, adding more nuts and seeds, automatically the bad stuff is you're going to eat less and less of the bad stuff. So instead of feeling risk, because that sometimes even creates anxiety when they're like, oh, you can't have this, you can't cook with this, you can't do this, you can't, they start to feel restricted. But if you say, oh, you can eat as many vegetables as you want, right? They start thinking, okay, which one do I actually like? And it puts you in a position of power where you can think about it better, and you feel like you don't feel so limited, and automatically your body starts to respond by reducing all the other stuff. So that would be the thing I want to say to encourage people. Don't feel restricted. Just try and figure out what you can add to your diet that is healthy, and that makes all the difference.
Oh, I love that. And it's just so freeing, and it's so empowering. And also, what I was going to also mention is, also dealing with the root cause of the stress. I mean, as we talk about this, these are broad strokes, right? I feel like each and every one of the things we've talked about is a whole episode on its own, but really trying to figure out what is the root cause of the stress. So even though we really showcased how to optimize your diet to improve your lifestyle and hopefully help with improving your blood pressure, there's so many other aspects of this. So it's not necessarily taking it in isolation, but if you're like, I don't even know where to start, this is one place to start. But then also finding ways to decrease that stress, I think is really, really key. And I know we sort of highlighted a couple of that. Physical activity is one good way. Exercise is one big stress reducer. Sleep as well. So sleep will reduce stress, right? I don't know if you wanted to mention any other, of course, some mindfulness practices and things like that. And I know where, even though we're not going to go delve into too much of that detail, but I just wanted to leave people with those highlights as well, just to kind of ponder upon.
Yeah, like journaling,
Mm.
meditation, I really well. And then just having a rhythm, like you mentioned earlier, you have a schedule in the morning, a routine that is already built in. So you have a daily practice that is built in, and that really does help because it builds resilience, which reduces long term. So yeah, so those are just some tips. There's a lot. There's a
I
lot.
know.
So I
I
guess
know.
touch on, and you mentioned where people can find me, and I do have a YouTube channel, and I do talk about a lot about lifestyle medicine behaviors that can help, and that's at InTouch Primary. So you can find me on YouTube at InTouch Primary Care. You can also find me on Instagram and Facebook and TikTok at InTouch Primary. So if you want more information, I have a lot of episodes on high blood pressure and high cholesterol and all those things that people deal with. So you can learn more information there too.
Awesome. Yes, absolutely. So, I think like we just talked about, this is a huge topic, right? And so I feel like we just scratched the surface. And I know that, and you guys need to follow Dr. Lola at InTouch Primary, and also on her YouTube. And I'll put all those links here, because she really delves into. You said what?
They can come to the clinic if you're in the Sugarland area too.
Exactly. And so if you are in the Sugarland area, yes, absolutely. Just come to the clinic. Yes, yes, yes. And then, just the content that Dr. Lola puts out is just so valuable. And so really a lot of everything we've talked about, she does provide those resources and provides the information on her YouTube channel. So absolutely, absolutely take advantage of that. Thank you so, so much for coming and just sharing your wisdom. And again, I talked about the fact that sleep is a priority. Really, if no matter what we do, if we're not prioritizing sleep, if we're not getting the sleep we need, it really makes it harder to achieve these goals of controlling your blood pressure, living a healthy lifestyle. So all that is really, really critical. And if you're on here and you're a busy, you consider yourself a busy woman, or a mom or a professional who just really has a hard time juggling everything, and sleep is sort of on the back burner, then just schedule a call with me at restfulsleepmd.com, and let's talk through this. Let's figure out how to get your sleep back on track. So I'm available to provide that resource. And so really, it's really combining all these things, and we're here to cheer you on. We're here to say it is possible. It is possible to live your best life. And as you've heard, Dr. Lola is helping so many achieve that already. So thank you again.
Thank you. Thank you, Dr. Fung, for having me.
All right, everyone. All right, everyone. Until next time, rest well.
All right. Bye.
All right. Bye.